कवर करने वाले हैं उसके बारे में हम डिस्कस करेंगे. ठीक है. So first, as you know that this is the prenatal and the postnatal classes. So definitely we are going to discuss about the prenatal, that means during the pregnancy time, and the postnatal, that means after the pregnancy time. But there is one more thing that we are going to be covered in our classes, that is the yoga therapy for the conception. Okay. So how much part that we are going to be cover in the classes? The first one that we will cover, that is the therapy for the conception. Okay, I'm going to elaborate it later to everyone. Then the second one is the prenatal. Prenatal is a time from where a mother conceives to the time of the delivery. So that is the time of the prenatal. Then we are going to have the postnatal. Postnatal time after the, okay, just give me a second, after the delivery of the baby. That is the postnatal time. Again, in the prenatal, there are few topics that we are going to be covered. For example, the Garbhsankar. Garbhsankar, again, it is going to be the part of the prenatal. Then we are also going to be discuss about the different complications that can be seen during the pregnancy and how we can control them with the woman. उन सभी को हम कंट्रोल कैसे कर सकते हैं वो भी हम यहाँ पर सीखेंगे. ठीक है. So how many part are there? First is the yoga therapy for the conception. Okay, why we need to cover this? It is not important that the woman will come to you after having their delivery. Even the most of the women will come to you because they do not conceiving easily. They couldn't conceive easily, so they will come to you because the doctor has recommended them either go for the artificial fertilization or that is IVF, in vitro fertilization, and the different types of techniques and the method for the conception. Otherwise, go for the yoga because the disturbance in the hormones, the different kinds of disease, for example, the high blood pressure, hyper and the hypothyroidism, PCOD and the PCOS can be the restriction for the conception. They restrict the conception, these kinds of disease. So these can be cured only with the help of the yogic practice, yogic therapy. So first we are going to be cover the yoga therapy for the conception. There is a data about the conception, the unsuccessful conception, and the couples who having the problem of the conception are the 15%. That means there are the 15% of the couple. That means in every 100 to 15 couples having the problem in their conceiving. So the first part is going to be the conception, where we are going to be learn first the possibilities behind the unsuccessful fertilization or not conceiving, then the disease that may affect their pregnancy, then diet, then daily routine. So these are the things that we are going to be covered. We are also going to be covered the different kinds of disease. For example, the issue related to the vitality, PCOD, PCOS, thyroid, hypertension, okay, and the poor reproductive health, poor strength in their pelvic region. Okay, so these are the points that we are going to be covered in the therapy for the conception. Then the second part, once we will cover the therapy part, then we will move to the prenatal part. The first topic that we are going to be covered in the prenatal is going to be the few guidelines. That is very, very important. The guidelines about the pregnancy. So that will give us a basic idea that which kinds of yoga practice, pranayam, and the exercise we should do with the woman. So the guideline for that, for example, the guideline about the asanas, how much bending we need, how much twisting we need, okay, and which kind of breathing we should do during the pregnancy. Then we will move to the next topic, that is going to be the changes during the pregnancy. Okay, the physiological changes during the pregnancy, because they are going to be happen with every woman. On the other hand, they are going to be, and every woman have to suffer from those issues that comes because of change in physiologically. ऐसी समस्या जो फिजियोलॉजिकल चेंज होने की वजह से बॉडी में दिखती हैं, तो उन इश्यूज को लेकर के हमें जो है थोड़ी सी डिस्कशन करना होगा, and that will give us a wonderful idea that how a woman is suffering during the pregnancy, how much she rest she need to take, what are the problems that she can see in her body, and she don't need to panic about their changes. Okay, these are the topic that we are going to be cover in the physiological changes during the pregnancy, because you know there are so many changes, the changes in your reproductive area, the changes in the digestive system, the changing in the breathing pattern, even the changes in the heart and the circulatory system as well. Okay, so these are some changes that we are going to be discussed in the second part of the perinatal. Then we will divide all the three trimesters and we will learn the practice according to the three trimesters. The issues that can be seen in the first, second and third, and the exercise according to them. So our complete 9 months is going to be divided into the 4 parts. The first trimester, that means the first 3 months, first, second and third month. Then the second trimester, the fourth, fifth and the sixth month. Then again we are going to divide the next 3 months into 2. The 7th, 8th month and the 9th month separately. Okay, let's have a brief discussion about the first trimester. So I will tell you later why the first trimester is the most riskier trimester from all of them. So how we need to practice during the first trimester. And we are also going to be discuss about the different condition. For example, if the woman have the in vitro fertilization IVF process, she conceived with the help of the IVF process, then how she will do the yogic practice and when she need to start their yoga practice. If she having the different kinds of complication, then how we can go through with the yoga practice. For example, if she is having the high blood pressure during the pregnancy, migraine during the pregnancy, back pain during the pregnancy, and any kind of issue during the pregnancy, so how we are going to perform the exercise and the pranayama. Okay, what are the things that we can do in the pregnancy, the which kind of meditation, the which kind of yoga nidra, how, in which position the woman is going to be rest, the best position for the rest during the pregnancy. So this is going to be the first part, the way of the sitting, the way of the standing, how to come from standing to the sitting position and sitting to the standing position. Then the second part that we are going to be cover, the next 3 months, that means the 4th, 5th and the 6th, as we know, they are safer than the first trimester and the third. At the same time, the woman start feel energetic during the second trimester when their body adopt the changes. That is the second trimester, when she start feeling good, energetic, happy. Okay, so which kind of exercise we can do and how to maintain the weight if the woman is gaining lots of weight during the pregnancy. That is not normal for the upcoming time. So we can manage the weight in the second trimester. How we can manage the weight in the second trimester, we are also going to be discuss about this. Then the third trimester, we will move to the third trimester, and as I told you, the third trimester we need to again divide into the 2 parts, the 7th and the 8th month and the 9th month. Let's discuss about the 7th and the 8th month. The motive during the 7th and 8th month, that the baby should not move to the pelvic region. Otherwise, there will be the chance of the premature delivery if the baby will move to the downside. So the exercise is going to be different in the 7th and the 8th month. We need to be very careful. there are so many issues can be seen during the 7th and the 8th month. For example, because of the growth of the uterus, the woman may start feeling the problem in the breathing. Growth of the uterus, the woman will start feeling the issues during the urination, in their digestive system, the bloating, gastric, and the different kinds of issue, the indigestion, blood circulatory related issues. So these are the issue can be seen more oftenly during the 7th and the 8th month. So how we can tackle, how we can face this issue, and how we can overcome with the help of the different yogic practice. Then the 9th month. The 9th month is going to be completely different from the 7th and the 8th month. Because in the 9th month, we need to move the baby to the pelvic region for the normal delivery. Whereas in the 7th and 8th month, we need to protect the baby to move into the pelvic region to protect the woman from the premature delivery. And in the 9th month, we can see just opposite case. We need to move to the baby to the pelvic region. So the exercise is going to be completely different. Some exercise that will help the woman in future to ease their labor pain. And the complication that can be seen during the time of the delivery. For example, the baby's head is stuck into the pelvic region and the baby has changed their position, that is the breech baby position, when the head come up and the leg come down. So certain issues can be seen in the 9th month. So how we can overcome with the help of the yogic practice that we are going to again discuss in the 9th month. And after those all the months, we are going to be discuss about the Garbhsankar. The Garbhsankar means a, giving a training to the baby inside the womb on the basis of what the baby can learn inside the womb. The temperament of the baby, chitta prakriti, that means the sanskar, baby ke sanskar, how we can decide inside the womb. Okay, how to work on their intelligence, how to work on the baby's intelligence in the womb. So baby will be born physically healthy, mentally healthy, and also the socially healthy. So some practice that we can do for the training of the baby inside the womb, that is the Garbhsankar. Okay, we will learn the different way of performing the Garbhsankar. Then the next part that we are going to be cover is going to be the mechanism of the delivery. Okay, the mechanism. Okay, before the mechanism of the delivery, we are going to discuss about the certain issues as well. There are so many issues during the pregnancy. Some are the normal and the common issue that can be cured easily. For example, the headache, bloating in the stomach, poor vision, insomnia, morning sickness, that can be managed with the help of the yogic practice completely. And there are some different kinds of complications that are also known as the severe complication during the pregnancy. First, we need to protect the woman from landing in those complications. But if anyhow the woman has landed in one of any complication, then how we need to tackle with the whole time. How we need to tackle with those complications. So what are the complications that we are going to be discussed? That is going to be the ectopic pregnancy, then the short cervix, placenta previa, cover the different kinds of the complication. Okay, as I told you, the short cervix, placenta previa, eclampsia, preeclampsia, and the oligohydramnios, hydramnios. These are some conditions that are the complicated. We need to be very, very much careful about them. Then another part is going to be the mechanism of the delivery. How the woman feel the labor pain, which kind of the breathing she need to do during the labor. There are the different kinds of the pain that can be seen during the pregnancy. There is another kind of pain known as the false pain, and also the Braxton Hicks contraction that is similar to those delivery pain, that is similar to those labor pain, but the woman need to differentiate between them. Okay, so the changes for the delivery time, how the woman can see them, how the woman can feel them, and what is the mechanism of the delivery, and what are the hurdles that can seen during the delivery time when the baby's head stuck into the pelvic bone, and how we can manage this condition. This is going to be the part of the mechanism of the delivery, and after that we will move into the next part, that is going to be the postnatal. So the postnatal part is again very important to us, because the postnatal part is going to be decide the whole life of the woman, the problem that she need to cure in their body with the help of the yogic practice. So in the postnatal time we will learn when the woman need to start with the exercise, in which time and how long the woman need to start their practice, from which part of the exercise the woman need to start, and what are the things that on which we need to cover, on which we need to work for the cure of the woman. For example, the prolapsed uterus, the shaggy belly, and the different kinds. For example, the back pain, the change in the posture. There will be the curve in the back side because of the change in the center of the gravity during the pregnancy. Okay, so the poor strength in the reproductive health, the poor strength in the stomach, and the diastasis recti. So these are some conditions that can be seen during the postnatal time, and how we can cure them with the help of the yogic practice. How the yoga is going to be fast recovery for a particular woman. The shape in the, and also once again to maintain the shape of the woman that can see after the delivery of the baby. Okay, so these are going to be the part that we are going to be discussed in our complete prenatal and postnatal teachers training course. Okay, so one by one we are going to be discussed, and we are going to be cover all the part, and at last I hope you are going to have lots of knowledge about the prenatal and the postnatal classes. Okay, so anyone having any question? So you can ask me. किसी को कोई क्वेश्चन है आप पूछ सकते हैं कि ये वाला पार्ट है किस तरीके से कवर होगा, या कोई भी आपके मन में लेकर के.
यस मैम. मैम ये सिलेबस में योगा थेरेपी विन्यासा प्रीनेटल योगा पोजेस, तो ये भी आप हमें सिखाने वाले हैं?
विन्यासा प्रीनेटल योगा पोजेस नहीं होता मैम, पोस्टनेटल विन्यासा योगा होता है.
एक्चुअली ये जो आपने भेजा है ना, जो सिलेबस हमें भेजा है उसी में है विन्यासा प्रीनेटल योगा पोजेस.
ओके मैम, वो आप उसको सभी लोग करेक्ट कर लीजिएगा, क्योंकि विन्यासा आप प्रीनेटल के ड्यूरेशन में, विन्यासा यानी होता है फ्लो, एक लगातार फ्लो में योगा करना.
यस मैम.
हाँ, और प्रेगनेंसी के ड्यूरेशन में आप लगातार प्रैक्टिस नहीं कर सकते, यू नीड टू हैव अ डिफरेंट टाइम का रिलैक्स. जी बिल्कुल.
तो ऐसा हो सकता था ना, मतलब विन्यास हम कैसे कर सकते हैं फ्लो में, वो सब
बिल्कुल डेफिनेटली बिल्कुल सही आपका कंसर्न. तो उसको आप पोस्टनेटल में करिएगा.
मैम एक चीज और मुझे आपसे पूछनी थी, मेरी सर से बात हुई थी. एक्चुअली मैं क्लासेस लेती हूँ पहले से प्रीनेटल योगा के, बट कुछ प्रॉब्लम है इसलिए मैंने आपको ज्वाइन किया कि ब्रीच पोजीशन में हमें क्या करना चाहिए. मेरी एक स्टूडेंट है और अभी 8 मंथ उनको स्टार्ट हुआ है और उनको ब्रीच पोजीशन है, वो बहुत टेंशन में है. पहले 2 स्टूडेंट का ब्रीच से नॉर्मल हो गया है, बट अभी और क्या क्या हम ऐसे चीजें कर सकते हैं, तो वो क्या आप मुझे थोड़ा पहले बता सकते हैं? सर ने बोला था कि आप कर सकती हूँ.
देखिएगा जी, बिल्कुल मैं सभी की हेल्प करती हूँ. जैसे कि अगर आप लोगों का एग्जांपल मैं फर्स्ट ट्राइमेस्टर पढ़ा रही हूँ और आपके पास थर्ड ट्राइमेस्टर का स्टूडेंट है, तो उसके रिगार्डिंग आप मुझसे कोई भी जो भी क्वेश्चन है या उनका इश्यू है पर्सनली आप लोग पूछ सकते हैं. ठीक है, तो वो मैं आपको पर्सनली बता दूंगी मैम. क्योंकि
ओके।
क्लास में हम साथ में कवर करेंगे टाइम के अकॉर्डिंग, लेकिन किसी को अगर नीड है उसकी तो आप पर्सनली पूछ सकते
यस मैम। ओके, थैंक यू
हैं।
मैम,
जी,
बस मुझे यही
ओके,
पूछना
थैंक
था।
यू।
चलिए।
ओके, एनीवन
मैम
एल्स?
मैम कुछ
जी,
डाइट रिलेटेड भी होगा इसमें टॉपिक?
हाँ, देखिएगा, डाइट रिलेटेड आपका चलेगा ट्राइमेस्टर वाइज, क्योंकि डाइट में आपका क्या बताया जाएगा, ये नहीं बताया जाएगा कि उनको क्या क्या लेना है, या डे से शाम तक का दाल चावल इस तरीके से नहीं बताया जाएगा कितना कैलोरीज उनको लेना है, ठीक है, कितना उनको कैल्शियम लेना है, ये अमाउंट आपको बताया जाएगा। क्योंकि क्या होता है ना, प्रेगनेंसी में जैसे मैंने तो डिसाइड कर दिया यू हैव टू टेक दैट मच मिल्क, बट देयर इज अ हाई पॉसिबिलिटी दैट द वुमन गेट द एलर्जी ड्यूरिंग द प्रेगनेंसी विद दैट पर्टिकुलर फूड आइटम। तो वो अपना भोजन वो खुद डिसाइड करेगी, शी इज गोइंग टू डिसाइड द फूड बाय हर ओन, बट वी विल हेल्प हर दैट हाउ मच प्रोटीन, हाउ मच कैल्शियम शी नीड टू टेक। तो उसके बारे में हम डिस्कस करेंगे, क्योंकि प्रेगनेंसी में आप किसी एक डाइट प्लान पर वुमेन को रेस्ट्रिक्ट नहीं कर सकते, शी नीड डिफरेंट एवरीथिंग एवरी डे, उनको हर दिन कुछ अलग चाहिए, अदरवाइज शी गेट बोर इजिली, बहुत जल्दी ड्यूरिंग द प्रेगनेंसी आप एक फूड से बोर हो जाते हैं। ठीक है, तो क्या अच्छा होता है खाने के लिए, स्पेशली क्या एज अ मेडिसिन काम करता है ड्यूरिंग द प्रेगनेंसी, कौन कौन से ड्राई फ्रूट्स अच्छे होते हैं, किस ट्राइमेस्टर में अच्छे होते हैं, तो ये सभी चीजें हम पॉइंट वाइज डिस्कस करते हुए चलेंगे। ठीक है जी, एनीवन एल्स? किसी और का कोई डाउट है? Anyone else in the class having any doubt regarding the class? ओके, तो आज के सेशन को हम यही खत्म करते हैं। आई थिंक किसी का कोई डाउट नहीं है, और हम सेशन स्टार्ट करते हैं, जैसे जैसे आपको चीजें क्लियर होती जाएंगी तो आपके मन में उसको लेकर के फिर और क्वेश्चन भी उठेंगे। ठीक है, तो फिर हम यहाँ
मैम
पर क्वेश्चन
मैम
आपकी क्वेरीज के लिए।
एक्सक्यूज मी मैम,
जी, जी बताएं।
हम कब से स्टार्ट कर सकते हैं योगा प्रीनेटल में?
प्रीनेटल में आप जैसे ही कंसीव करते हैं ना, तो वैसे ही आप अपनी योगा प्रैक्टिस स्टार्ट कर
कर
सकते हैं।
सकते हैं?
जी बिल्कुल। ठीक है, एनीवन एल्स? और पोस्ट नेटल में आपको लगभग 3 महीने का गैप रखना होता है। वैसे तो 6 वीक का गैप होता है, क्योंकि आफ्टर द डिलीवरी ऑफ द बेबी कंटिन्यूअसली ब्लीडिंग चलती है। ठीक है, 6 वीक तक, यानी कि आपकी कोई 1.5 महीने, 1.5 मंथ के अप्रॉक्स, तो आप कम से कम 2 से 3 महीने का गैप रखते हैं। ओके,
Ma'am, I have a
एनीवन एल्स?
question. Yeah, I have
जी
a
बताएं।
question, ma'am. As you told, PCOD, PCOS, and unhealthy uterus, like these type of difficulty also, we are going to discuss. So,
यस,
these issues we are going to discuss before prenatal or in between of this we are going to do. What is the
ओके मैम, this is going to be the part of the therapy for the conception. That means that we are going to be cover very first. ठीक है,
okay?
प्रीनेटल के conception.
So, for this also you'll give us the diet part and yogi asana.
Okay, we are also going to be discuss about the diet for the conception. कंसेप्ट कंसीव करने के लिए एक अच्छी डाइट क्या होती है, वो हम जरूर डिस्कस करेंगे।
Sure. Ma'am, actually my two students are PCOD patients and they want
जी,
like 1 or 2 month if possible. So just she asked me, कि, ma'am, how long it will take to cover it.
ओके मैम,
So
द पार्ट इज गोइंग टू बी कवर द थेरेपी फॉर द कंसेप्शन, द पार्ट इज गोइंग टू बी कवर विद इन द 7 डेज। जैसे ही हमारी क्लास स्टार्ट होगी तो 7 डेज में ही आपका पूरा कंसेप्शन वाला ही पार्ट कवर हो जाएगा।
no, actually that my student asked me like he started my yoga class. So approx how long it will take to cover this PCOD and PCOS problem? Just she asked
ओके,
me. So in this case,
फ्रॉम
what should I reply?
आई डिड नॉट गेट यू मैम, मुझे क्लियर नहीं हो पा रहा है आप क्या कह रहे
Yeah, ma'am. Actually, just before 3 days, my in my class, a student joined, and she's having PCOD on borderline. So she
हैं।
asked me, "Ki, ma'am, how long it will take to cover my PCOD problem?" So just
ओके,
what shall I reply her? Ki
आई गॉट इट।
two
ओके, आई
months should
गॉट इट
be.
मैम। So the therapy for the conception, the therapy should run at least for the 3 months for any kind of disease. to see a good result. लगभग आपको 3 महीने का समय चाहिए होता है एक कोई भी जो प्रॉब्लम है बॉडी में उसका एक अच्छा रिजल्ट देखने के लिए. At least the 3 months should be there. So it will take the 3 months to once again come back to the normal condition. Okay, 3 मंथ का आपका चलेगा. उनका जो थेरेपी है आप जो भी कराएंगे उनको whatever you are going to be performed with her for the problem of the PCOD and the PCOS is going to be run for at least for the 3 months. Okay. Anyone else?
Shubhaji, I have a query.
Yes, ma'am.
For postnatal exercises, those can be normal exercises or there are specific exercises for postnatal?
The exercise, the name is going to be the similar with the asanas name is going to be the similar, but the way of performing those asanas is completely going to be the different for the pregnant woman. Even the sun salutation that we do during the pregnancy is completely different from the sun salutation that we do normally. So the asanas name you will get the similar, but the way of performing them is completely going to be the different. We are going to use the different kinds of prop, the supports for that particular asana.
In postnatal as well.
In postnatal, okay, the postnatal again will start with the very gentle and the normal exercise, but later on we will slowly move to the hard exercise to once again maintain that core strength, that thigh strength, leg strength. So gradually we need to move from very beginner to the intermediate level.
Okay.
Okay.
Okay. Thank you.
Okay. Thank you. Anyone else? किसी और का कोई डाउट है? Okay, so I think everyone's doubt is clear, and we'll see you in the next class. And thank you so much, everyone, for joining. And
Thank you so much,
I
ma'am.
hope you like the topic. Thank you so much.
We liked it. And ma'am, one more thing, like now we have joined as a group in our class, so we all can give our brief introduction. So
Yes, ma'am, definitely.
So it will be good for our communication. Any doubts we can discuss also.
Yes, definitely, ma'am. So we are going to have the introduction on tomorrow. So
Yeah, sure.
I will give you an instruction on the group. So everyone need to join the class. It's compulsory on tomorrow, and at that time I'm going to take the everyone introduction. And there are the few conditions that you have to must follow. That keeping your camera on during the classes. Okay, that is very, very important. And because I'm going to teach you the different kinds of exercise, and you have to do it with me, and I have to see you at that time whether you are performing it correctly. If you will learn it correctly, only then you can perform it correctly with the pregnant woman. So it is going to be our responsibility that if you are learning it correctly or not. So this is again very, very important to keep everyone's camera on during the classes. Okay.
Okay, thank you so much.
Thank you, ma'am.
Thank you, everyone. Thank you so much, and take care.
Thank you, ma'am.
Thank you.
Hello,
Thank you.
everyone. Thank you. Bye. See you.
Thank you. Take care.